concerning Fort Smith Ebbing Air Force Base. First announcement is I'm announcing a 3% performance or merit bonus for state agencies, which will be distributed to state employees based upon performance. This last year, our workforce has shown dedication, resilience, and flexibility during this pandemic. It's been circumstances that no workforce has been through in the last 100 years. From the Department of Health workers who have worked extraordinarily long hours under difficult circumstances, to workforce services that's worked on a front-serving basis to get the pandemic unemployment insurance out, the unemployment insurance out, to our Department of Human Service caseworkers that have helped to take care of children even during a pandemic. I'm very pleased that we'll be giving the agencies a 3% performance or merit pay raise that they can use to distribute to high-performing and qualified employees. This is the largest performance pay amount since I became governor. And I would remind you that this will go into the employee's base salary, so it's not a one-time bonus. The cost to the state is $11.2 million of state general revenue and $28 million from all sources. That includes the federal sources as well. In area of background, as I move on to another topic, last week it was announced by the Acting Secretary of the Air Force, our federal delegation, myself, joined in the announcement of the F-35 fighter jet training program at Ebbing Air National Guard Base in Fort Smith. I have Brad Hegeman here, who is the chair of the Military Affairs Advisory Committee. I want him to speak to this in just a moment, but I wanted to emphasize a couple of important points here. First of all, we created the Military Advisory Committee after I first got elected governor, and the design was that economic development is about creating and recruiting industry and growth of our existing industry here, but we've never concentrated and made our military installations a recognized part of economic development. Our Military Affairs Committee changed that. And part of the result of that is the success that we've seen in the expansion and the winning of missions at our military installations. What this means for the River Valley area is 825 new personnel. Of these, 180 will come from Singapore. It'll mean $800 million to $1 billion in economic impact annually to the state. And to put this in perspective, that is a 20% increase in the current economic impact that comes from our military bases. And so that is a large increase from this success story. One of the hurdles that we had to overcome in this is that we were advised that they needed 1,300 additional feet of runway that was needed for this training mission. The cost was $22 million, and it became clear to me that we probably were not going to be successful in getting this mission if we did not provide a pathway to get that additional runway. And so for that reason, the state committed $17 million for this project, and local government, the city of Fort Smith, committed $5 million to that project. Today, my staff will be releasing a letter to you, a letter to the Acting Secretary of the Air Force indicating our commitment to provide that additional $22 million in joint funding for the extension of that runway. And this is part of the success story. This is part of the hard work in not only recruiting industry, but also in terms of a success for our military installation. With that, I appreciate Brad's leadership. He's in the private sector, but he has donated his time as chairman of the Military Affairs Committee. So Brad, would you make your comments?
Thank you, Governor, and good afternoon. In September of 2015, the Governor announced the formation of the Military Affairs Committee with a very clear purpose: to protect our existing installation and missions and to position the state of Arkansas to acquire new missions. We began by assessing where Arkansas ranked with other states and identifying what areas we should focus on in order to accomplish the governor's mission. One report we referenced was the 2014 Association of Defense Communities State of Support, where they grade states based on the variety of criteria including military, family, and veterans issues, and Arkansas did not make that list. So we went to work immediately and began and prepared an economic impact study of all of the installations across the state. We developed a statewide strategic plan, and we employed a full-time military affairs director to lead that effort. Our first order of business was to address the military, family, and veterans issues and make Arkansas one of the most military-friendly states in the country. The state legislature has passed well over a dozen pieces of legislation addressing key issues such as exempting active duty and retiree military pay from state income tax, military spouse licensure reciprocity, the Arkansas National Guard Tuition Assistance Program, and the expansion of the Military Child Compact. Over the past 5 years, Arkansas has seen growth of existing missions at Little Rock Air Force Base with the addition of 4 C-130J aircraft and the opening of the 223rd Cyber Operations Squadron. New missions include unmanned flying mission at Ebbing Air Force Base, $100 million increase in production at Pine Bluff Arsenal, increased training at Fort Chaffee, increased utilization of Razorback Range, and the most recent announcement of the F-35 and F-16 missions at Ebbing Air Force Base. During that same time frame, Arkansas has been nationally recognized as a top 10 state for military retirees, a great American defense community, one of only 4 states in the DoD top tier for support of military families, and only one of a few states that has achieved an all-green rating in license reciprocity. All of that effort, all of that legislation, and all of the initiatives over the past 5 years positioned Arkansas to be the logical choice for the location of the new F-35 mission at Fort Smith. So, Governor, I'd like to thank you, our state legislature, our congressional delegation, and all the members of the Military Affairs Committee. The future is bright. I'm excited about where we're going, and I can assure you we'll continue to expand the military presence in the state of Arkansas. Thank you.
Thank you, Brad. And a reflection of that success, the importance of the Military Affairs Committee, is Act 522 that I signed into law, the General Assembly passed, making the Military Affairs Advisory Group permanent and part of our statute and our structure of government. So I think that reflects its success as well. And now let's move to the third area of discussion today, which is our vaccination efforts here in Arkansas. Let me first start with our case and vaccination update for the last 24 hours. As you can see, this is Tuesday, and our cases go up on Tuesday. Our total new cases are 231 new COVID-19 cases. We have an increase in active cases by 62. Of greatest dramatic increase is the change in hospitalization. As you can see, our hospitalizations went up 29 over the last 24 hours, and you're right, that's just a little bit hard to see. Then our ventilators went up 4 as well. Our vaccination doses given were 6,133 over the last 24 hours, so that's another strong performance that we want to continue through the course of the next month. Our testing was very similar to what it's been in previous days as well. And so this is not signifying a trend. We've been flat for the last 3, 4, 5 weeks, and we hope that continues, but we see this larger number of cases in the last 24 hours. And then, if we will go to the next one, I want to make an announcement today, and that is a change in our education policy. As we look at school next year, I'm pleased to announce that if you are in school and you have been fully vaccinated, then there will be no quarantine required if you are exposed to COVID-19. This is very important for our parents and our students. It means that you can continue in school, you can continue with your extracurricular activities, and this applies also to higher education in terms of their contact tracing and the fact that if you've been vaccinated, you do not need to quarantine. What this means for the students is that it will minimize education loss. They will be able to stay in the classroom. They won't have to quarantine. They will be able to continue their education even if they've been exposed to someone with COVID-19. Secondly, it will minimize disruption to the workforce. And you've heard the stories so many times of a parent having to go out of the workforce for 10, 14 days because their child is at home because they've been quarantined. And then finally, of course, we know how important extracurricular activities are, whether it's band or whether it's sports or whether it's a choir. The students can continue to participate in it. You're not going to have the same level of cancellations or postponement of games because so many have been quarantined or exposed if they have been fully vaccinated. And so the important message today is call the toll-free number that was there so you can get your vaccination. This is not something that should wait till next year. It needs to be done now for the students. They need to take advantage of that. Right now we have 10% of our 12 to 18 population, our school-age population that's been vaccinated. Obviously, we want that to increase over the course of the summer, so don't delay, get the vaccination, and before classes start next year. And then you'll see on the next one that this is consistent with CDC recommendations that they have indicated that fully vaccinated people with no symptoms do not need to quarantine. But this is good news for next year. It means that, and it defines what fully vaccinated is, another reason to get started on it. And then I wanted to show one more highlight before I turn it over to Dr. Romero. And if we can put this up. This shows what we're seeing in the number of COVID-19 related hospitalizations. On the left, you'll see the hospitalizations as of February 21 of this year, in which we had, looks like 494 that were in the yellow, which is 65 plus, and then underneath that, the category is 49 to 64. The orange-like is 25 to 48, and the bottom one is 24 years and younger. And you can see and so you go forward to March 21, the second bar graph, April 21, the third bar graph, and May 21, the final bar graph. And you can see the consistency of the numbers for those that are 24 years of age and under. You haven't seen any change there. You have seen a change in the 65 plus, that's been dramatically reduced because of the increase in vaccinations in that age group. What you see, though, is an increase. If you look at the orange, which is the 25 to 48 years old, in March that was 94, and then in April it was 114, and then in May 21 it's 154. So you see an increase in that age group, and that's the gap in our vaccinations. Older are getting the vaccination. We've got to get that younger group, the working person, get vaccinated, and that's one of the focuses that we have. And then I'm going to ask Dr. Romero. He's going to speak to the last graph and make his comments. Dr. Romero.
Thank you, Governor. I want to speak primarily to immunizations of individuals 12 to 15 and really 12 to 18. And point out, I think, to the general public that infection by COVID in this age group is not benign. And this is a study that was recently published from the CDC. And it takes one group of individuals, 204 adolescents between the ages of 12 and 15 that were infected and hospitalized. 1/3 of those individuals wound up in the intensive care unit, and 5% of them required mechanical ventilation. So the disease is significant, and it can result in long-term stay within the intensive care unit. We know that the vaccine is safe and effective in this age group, and that we can prevent this type of serious illness. Now, there were no deaths, and that is good, but again, the hospitalizations were prolonged. As the governor pointed out, we have begun immunizing this age group. We're at about 10%, but we need to use these summer months to move forward with vaccination so that these individuals are all vaccinated before they get to school. This will also impact significantly on their sports during the summer. So baseball, early football training, this will keep the teams together and allow them to practice together. So again, the vaccines are available. We can have them administered at some of the schools through our local health units, and pediatricians and healthcare providers do have the vaccine in their offices and will be administering it. So I'll stop there and turn it back over to the governor. Thank you, Governor.
Thank you, Dr. Romero. With that, we're happy to take any questions.
On the quarantine for students, would that same policy also apply to teachers? And how do they verify, contact tracers, I guess, how do they verify whether somebody has been fully vaccinated?
It certainly would apply to teachers, so if teachers have been fully vaccinated, then there's no need to quarantine. So, and that's a good point. It will help us to have the continuity in the classroom. And of course, the teachers have had access to the vaccine for some time. The students have had it for less time, and so that's part of the push today. In terms of how do you verify that, that is easy to verify through our contact tracing, through the Department of Health, through our WebIZ that is traditionally used for verifying vaccination.
For the most part, the only people going in to get tested are ill. Are we likely missing a significant number of cases that are going undetected, specifically in children, those school-aged kids?
I will comment and then ask Dr. Romero to. And the assumption is, of course, that we're not testing everyone, and therefore we're not detecting all of the cases that are out there. And that's why the greatest relevant figure is who's being hospitalized. But yes, based upon these numbers, everybody should be aware that COVID-19 virus is still in our community, and that we all should get vaccinated and be prepared. Dr. Romero?
So your questions and comments are correct. That is, surveillance is only as good as the degree of surveillance. So we do have fewer people undergoing testing as we compare this to the height of the pandemic. But we do have, as the governor pointed out, a good indicator of the disease is what we're seeing in the numbers of individuals being hospitalized. So certainly we'd like to have more robust testing, but because people aren't sick, because they're not having a lot of symptoms, they're not seeking these. And you asked the question about children. So children do tend to have milder disease. We found infants that are asymptomatic, that is, they have no symptoms but test positive. So without really going out and screening more and more people, we can't give you a clear sense of what the disease. It's reassuring, but we're concerned that there can be significant disease circulating in the state.
Anything else?
In terms of the number of vaccine doses that are going to be expiring, and have you looked into the possibility of sending those somewhere else where they might be able to be used in
The answer is yes. I spoke to the White House about our vaccines at the end of the month. First, I do hope that we'll be able to get those out before the end of the month, and so we won't have any wastage or any that are expired. And the first thing I would like to see, if there's any doses, whether it's Arkansas or elsewhere, that are unused, that we get those to India or to Brazil, other places that need it. It is not lawful for a state to do that. It takes the federal government to do it, and the federal government, is taking that on to send additional doses to those countries. The other option is to share it with other states, and every state's in the same boat we're in, that they have some doses that are set to expire. So the solution is that if the Department of Health is in possession and has maintained that in their inventory for the doses, then the doses can be quarantined, and the CDC will continue to do, and I guess the FDA will continue to do testing on whether the life should be extended. And they're optimistic that that can be extended if it's kept under the correct conditions, and so we could be notified that those doses can continue to be used in the future. Dr. Romero, do you have anything to add to that?
No, that's exactly
Okay.
Percent on merit raise. I know the president of the State Employees Association had written you expressing concern about the cost of insurance premiums increasing for state employees in the health insurance plan. Is that 3%
Yes.
supposed to offset the full cost of that?
No, I mean, I'm aware that there's going to be, additional costs to teachers, state employees in terms of health insurance premiums, and so that is a part of the factor. That's an inflationary increase of healthcare costs, and so while we can't always accommodate that, that was an important recognition and part of the reasons that we had a more significant increase. Secondly, as I stated, is just the performance that they've done over the last year, and we're in a position that we can do that. So I'm very pleased, and we do have money set aside in a performance fund, as you know, Mike, to take care of this, but they were first expecting them to be able to handle that within their budget.
Excuse me, I may have misunderstood you when you talked about this state commitment for runway extension.
Yes.
Okay. Is that 17 million or 22 million?
17 million. So it's the total cost of the runway extension is 22 million. City of Fort Smith's covering 5, and the state will cover 17.
Where's that money coming from?
It can come out of two options. One would be the legislature approving the use of additional funds, either rainy day or restricted reserve. The other option would be the quick action closing fund. With that, thank you all very much.